Hello, Wave Country. I'm John Ramsey, and welcome once again to a very special edition of Wave 3 Listens Live. Today we are at CaloSpa once again, but this is a little different. This is going to be an educational and very interesting and informative show because we're going to go behind the curtain a little bit and show you what it's all about here at CaloSpa. A side of CaloSpa that you have not seen where the magic happens. We are in the OR right now. I am joined once again by Dr. Chet Mays, Dr. Bradley Calabrese. Dr. Calabrese, okay. This is the official OR. What happens here exactly?
So we're actually sitting in the recovery room of the ORs, but it is our whole surgical suite, and we have a complete suite here with pre-op holding areas, our recovery room, and of course our operating suites. So everything that's important surgically happens here. So.
It's amazing. I did not realize this building, I don't know how many square feet, but every time I come here, you're showing me a different area. But this one to me, as far as most of your procedures, is this where the majority of them take place? Dr. Mays, is this where the majority of them take place?
The majority of surgical procedures, yes. You've been mainly over in the spa area. We also have a clinic area, but all surgical procedures go on here in our accredited surgery center. So it's an ambulatory surgery center, so that means basically everyone who has surgery here leaves the day of surgery. But they'll be recovered in these rooms, and behind you there are the operating rooms where we do all of our surgical procedures.
See, now a lot of spas, they have to go to a hospital. Here right. You are credentialed to do this kind of work here. Obviously, that's probably quite a process. Tell me about that, Dr. Calabrese.
Yeah, so we have to be certified. Matter of fact, for our boards in plastic surgery, we can't operate in an unqualified facility, so we have to be qualified. And so we have what's called quadruple ASF, which is our qualifying board that tells us everything's okay. And we're really proud. We do that every 3 years. And so this is our 12th or 13th year here at this surgery center. And every time we've done it, we've got a perfect score, and that's not easy to do. So we have to have a really good management team, and we just don't cut any corners as it relates to sort of the quality of the things we use. We use board-certified anesthesiologists, and we have all the best equipment. We have really, of all the groups around, we have the most modern anesthesia machines and stuff. We got all new, and I think it helps us to show that we don't run this like a doctor's office with an operating room, but actually a surgical center.
Doctor, you mentioned, state-of-the-art equipment, but also your staff is so vital here. And you have some people that have been with you a long, long time, which to me speaks to the culture here, very positive, but it also speaks to the level of expertise that you'll find here at CaloSpa, right?
Yeah, so my personal assistant in the operating room, my first assistant who operates with me every day, has been with me for 22 years. So she's been with my whole practice. So I've really barely ever been in the operating room since I lived in Louisville, Kentucky, without her always being by my side. So that's been the one consistent feature here. But even like my nurse manager, Julie, who runs the ORs, I've worked with for 15 years, and she's been with me since we opened this place in the ORs 11 years ago. And so I think, and my nurses in the operating room, Dawn's been with me out in the clinical space for 18 years, and we have many staff members like that. So it creates a culture where everybody's confident about what they do, and we see a lot of patients, and my patients feel confident with them taking care of them because they know they've been doing this for a long time.
Dr. Mays, we're going to talk about a lot of the procedures that take place here individually, but a little bit of an overview. So some of the procedures that are performed here, I know you take great pride in being very results-oriented here. So tell me a little bit about that, if you would.
Well, plastic surgery is head to toe, basically, so any procedure from the head down to your feet we'll do here. But the most common procedure is plastic surgeons, or breast augmentations. Those are the most common nationally, and by far here in our practice, that would also be the most common procedure is breast augmentation. So we do everything from faces to body to breast to legs to thigh. I can name every body part, and we do it here. But it's about doing it safely in an accredited center, because that's what's important. You'll see headlines all across the country or the world about people being injured during procedures or people waking up during procedures, and I just want to assure people that those did not happen at accredited centers by mostly board-certified plastic surgeons. That's what sort of separates us.
Yeah, you should be proud of that, because this is rare where you're doing it on-site. But obviously you had to jump through a lot of hoops, very detailed, very hard to receive the credentials that you've received. So congratulations to you and to attain that, right, Doctor?
Yeah, and I think that, for the patient experience, which is what it's all about, the level of privacy and confidentiality that we can do here at our own facility, and the level of cleanliness, and the idea that we don't really have to take care of sick people with infections and everything else in our facility because we're a cosmetic center, and that helps us a lot. Because when you have to mix my cosmetic cases with people that are in the hospital that have real illnesses and real problems, that can be a great challenge. So we like to keep things in our facilities so we can control all the experience for the patients and control things like infection, everything else, to keep it as clean and as accurate as we possibly can.
That makes sense.
Yeah.
That makes perfect sense to me. Wow, wow! I'm really truly amazed. I've never seen this part of your practice,
Right.
and I'm impressed. And who wouldn't be? Because as I've said before, there's a lot of facilities out there, but I know of not any other than this one that can actually do surgical procedures on site. And like you said, the confidentiality part I would think would be very important considering the work that you do here. Okay, I want to talk about a new year. 2019, it is here. So let's talk about CaloPerks Ready, Set, Goals. How can you aesthetically improve yourself? Be a better version of you is basically what we're talking about. So I like the idea, Ready, Set, Goals. What's this all about, Dr. Calabrese?
Well, it really, maybe you want to say more about it, but Ready, Set, Goals is the concept of starting the new year and saying that, I think often our patients get confused about what even to do. There's so many options, non-surgically and surgically, and so we wanted to start the new year by saying that we have an ability to work through your whole plan for the whole year. So come in and we're going to set your goals and we're going to find a treatment plan, and then when we do that, we can say, and here's how much it will cost you through the year to have those treatments. So you've set it according to your budget of what you think you can spend on your aesthetic needs, and then so you're really planning it out instead of just coming in periodically and trying to figure out what to do. And then if they want to, once we know what their budget is, we can set them up with CaloPerks, which is where we can cost spend it, and they can actually, we'll put so much on their credit card every month to sort of budget it out for them and help them. And if they're part of CaloPerks, then you get a discount always on everything you get here at CaloSpa.
All right, let's talk about a giveaway that we have today. Okay, Dr. Mays, help me out here. From what I understand, okay, maybe you're putting some thought to this now, and you're saying, what do I need to do aesthetically to improve my look for 2019? Right. And if you tell us about that on Instagram or Facebook.
Yeah, we love giveaways here. We also love our fans out there on social media as well. So everyone on Facebook and Instagram, if you tag at CaloSpa and tell us what your 2019 aesthetic goals are, you'll be entered into a $250 gift card giveaway here at CaloSpa and CaloAesthetics Plastic Surgery Center.
And if you come in and do your Ready, Set, Goals, and you sign up for CaloPerks, at the end of the month of CaloPerks, this whole Ready, Set, Goal, we're going to do a drawing for a giveaway for all those that sign up for CaloPerks, and somebody's going to win a $1,000 gift card to CaloSpa. So it's a nice little more incentive to sign up for CaloPerks and come in and see us and kind of work through their plan for the year.
And once again, Facebook, Instagram, at
CaloSpa.
At CaloSpa. I want to make sure I have that correctly. And one lucky viewer right now will win $250. And as you said, you can raise that up to $1,000.
I feel like we're just giving money things away all the time here. It's crazy.
I love it. Okay, once again, we are in the OR. As I said, we're taking a peek behind the curtain at CaloSpa. It is amazing. They do amazing work here. And coming up, we're going to talk about some of those procedures. Breast augmentation, tummy tucks, body contouring. We'll talk about all of that with the two doctors in charge here from CaloSpa. We'll be back.
At the CMA Foundation, we believe every child should have the access and opportunity to participate in quality music programs. I'm Sarah Evans. Music has always been a huge part of my life. Music education isn't just important if you're going to make it your career. It also helps children develop the abilities that set them up for lifelong success. Music is transformative, and I want to ensure that it is never silenced. Learn more at itstartswithme.org.
Hurt in a car? Call Sam Aguiar.
When you're injured, here's what to look for in your lawyer. Someone who fights for you like they would their own family and has earned a reputation for winning big cases. I'm Sam Aguiar. We're proud of every verdict and settlement we've won because of the difference it's made in our clients' lives and the difference it could make in yours.
Hurt in a car? Call Sam Aguiar. 888-8888.
Once again, we are coming to you from the OR at CaloSpa, located on Lime Kiln Lane. Ready, set, goals for 2019. What are your aesthetic goals? Perhaps, and the first topic that we're going to talk about, first procedure, is breast rejuvenation. I want to make this clear because I'm always amazed at how much you travel. But you're not just considered the best here in Louisville, but one of the best around the country. Dr. Calabrese, you were going to speak at a breast symposium. What I thought was really cool about this is apparently you're going to perform live surgery, I guess, to show everyone new techniques and how you perform the surgery. Tell me about that.
Right. So, as you know, and we've talked many times here, I do travel around the world and in this country, and I'm one of the key opinion leaders as it relates to breast surgery. And although I do everything in plastic surgery, I surely don't talk about everything in plastic surgery. I only talk about breast. And this is called the Atlanta Breast Symposium. It's probably the most respected breast meeting of the year, and it's about cosmetic breast surgery, but also reconstructive breast surgery. And it's every year in January. And so it's always an honor. Back in 2009 was the first time I was ever invited to be the faculty to speak at this one, and it's a big deal because it's the big meeting, it's the important meeting. Since that time, this is my 11th year in a row being faculty. I've been a faculty every year since 2009, and here it's coming up again this month. And this will be my 4th time that they invited me to do live surgery as part of the symposium, which means that all the plastic surgeons will be in the conference room, and they have all the cameras in the operating rooms at Northside Hospital, and then they will watch me operate, and we teach and lecture while we're doing that. They can ask questions, and we go through new techniques, and I'll be using some new implants, new mesh supports called GalaFlex or GalaShape, and doing something called a neosepectral pocket, which is something that many plastic surgeons don't even really know how to do. And so I think we are trying to show them more innovative, more challenging cases. We do a lot of revisional breast surgery here. There's a lot of women who have had implants for a lot of years, and over the years they need them fixed, they need improvements, and those become a little bit more challenging cases than doing a straightforward first-time breast surgery. So that's what this case is. They want to do it something a little more complicated and a little more interesting for the faculty. They're all plastic surgeons there, so they all do breast surgery, so you want to make it interesting.
Before we move on from this topic, though, breast rejuvenation, breast augmentation, two totally separate, correct? And I am curious about how breast surgery has evolved, how breast augmentation and rejuvenation has evolved quite a bit, I would think.
Oh, of course. I mean, breast rejuvenation sort of is all-encompassing everything breast surgery, in my opinion. Yeah. Breast augmentation just happens to fall under that category. With women who have breastfed or women who have had children or weight loss, their breast is going to go through changes, whether it's they need more volume or things aren't where they used to be and we need to lift them back up. But it's not just breast. Dr. Calabrese and I were writing a lot of chapters together. Now that I've been here 2.5 years, is that we're publishing, and he's written many more papers than I have. But it's about education. But we don't just do breasts. Even though we write chapters on it, we do everything from mommy makeovers to tummies to total body rejuvenation. I know we talk about breast a lot because that's what we write about, but we do everything here. I mean, half of our practice is facial cosmetic procedures, which most people don't realize that because we're so vocal about our breast experience. But as far as breast rejuvenation, it encompasses everything from breast reduction to breast lift to maybe we're not using an implant, maybe we're using your own fat to build volumes because not everyone wants an implant. So we can, for the right patients, we have a whole variety of procedures that we can do for them. That's not
and breast is the most common procedure done in the plastic surgeon's office. So it's important to talk about it because there's just so many more women who are going to have breast surgery every year than they're going to have a facelift. And so just by chance, it is an area that we do, there's so much of it. So I'm very, very happy that I became known as a breast surgeon than as maybe like the facelift surgeon of it, because there's just so many more patients that you can take. And so today, as an older, getting older, in my 22nd year in practice, I do a lot more facial rejuvenation because I've had patients for 22 years, and all those patients have gotten older with me, and so they're in facelift land like I am, and so so we end up doing their facelifts. So
and they trust you.
Yeah, we have a relationship, and so they're going to only go to me because we have that relationship. So
let's talk about facial rejuvenation. We talked about breast rejuvenation. Tell me a little bit, what does that involve, Dr. Mays? Is that, I mean, there's so many different parts of the face and different procedures. Tell me about that.
Right, so it's about sort of combating the aging process. So aging is loss of volume, so we got to get volume back in the face. Sometimes we'll do that with patients' own fat. Sometimes we'll do that with some of the dermal fillers out in the spa area. And the next thing is laxity. People will get laxity in their face and the tissues and the skin and the muscle. Then we go in and tighten that laxity. Surgically, we do it with facelifts and neck lifts. We also have things in the Medi-Spa that we can do that I'm not going to speak much on today because this is a surgery day. And then the third thing is texture, so your skin texture. Those are the three main things we're trying trying to combat when we're trying to do facial rejuvenation. But it's pretty much what you can think of: eyes, faces, lips, noses, ears. We do everything to rejuvenate down to the neck.
And Dr. Mays does great noses and does all of our rhinoplasties in the practice. You know, we do hair rejuvenation and hair transplants for male patients too. You know, for men, hair restoration and eyelids, very, very common. Rhinoplasties a little bit, nose jobs are pretty common procedures, and then sometimes facelifts for them. You know, women do more brow lifts with it, a lot of eyelid rejuvenation as well, and definitely they start thinking about Botox, fillers, leading up to the facelift. The whole idea of this place, CaloSpa, which was to take the patient through the experience of just coming in for a facial, super simple, all the way to having a facelift, you know.
To being here.
Yeah, we said it was a manicure to a mommy makeover, even though we don't do manicures anymore. It was doing the simplest to the most complicated, the whole ladder of things that we can do, and providing them all here in the safety of a plastic surgeon's office, so we can walk them through the aging process. And I mean, one of the last newsletters we did, maybe it wasn't this year, but the last year, was all about the second to 20 years, the 30s, the 40s, the 50s, and the 60s. And we had sections on it of what are we dealing with when we're 20 years old? What are we dealing with when we're 50 years old? They're different things, and they need different treatments. And so we try to walk through our patients with that.
Interesting. That's what Ready, Set, Perks is all about.
Yeah.
It's kind of a game plan.
Right.
If you're looking to improve yourself aesthetically at CaloSpa, you guys want to make sure that there is a plan, that there's a goal.
Right.
I like that. And I think probably quite a few of your clients would like that as well, because instead of just going, okay, I think I want this, I think I want this, well, let's have a little consultation, and let's do everything in the correct order so that you stay your very best, right? Right, Dr. Mays?
Oh, of course. And that's the beauty of this place. We can offer it all. You know, not everyone's a surgical candidate. Not everyone's a non-surgical candidate, but we have all the latest and greatest procedures and techniques that we can offer that to all of our patients.
Well, I saw a boy in follow-up today who had gynecomastia, and so we fixed it. He's doing great, and he's done. So his mom was off to the side with him, and so then she was looking through one of our magazines, and she was like, now to me. And so then she started talking. She said, well, I'm trying to figure out if I need Kybella or if I need old therapy or if I need, and I was like, well, why don't we start with what bothers you? You know, let's go back to like, what are you trying to fix? What don't you like? What do you would like to see improvement? Then I'll walk you through some of the treatments that are appropriate. So I think that we should do that more often, is start with that consultation, the plan. What's bothering you? What are we trying to fix? Then we'll let the professionals, we'll sort you in through the procedures that you do. It's so common. People get on the internet and do research, and they start finding these procedures, and they don't get back to what's your problem? What don't you like? We'll walk you through. There's a lot of things you probably don't even know. There are options.
See, I think that's interesting in that you've got state-of-the-art technology. Obviously, you know, you two are two of the most knowledgeable doctors in the country. You got that combination here, and now we've got a game plan. So I think that's what it's all about. Maybe sometimes that is the missing component. And you talked about men, too, and we're going to do that a little bit later on. My go-to joke, of course, is they won't let me on airplanes with these 2 extra bags.
Oh, right.
They said, go ahead and
I barely saw them. That's interesting.
That's all I'm looking at this whole time.
Exactly.
Also, want to remind you before we go to break, if you're on Instagram, if you're on Facebook, again, at CaloSpa, you could win $250 in CaloPerks cash here.
Yeah.
CaloCash?
Yeah, CaloCash.
Thank you very much.
Yeah, exactly. You know all the lingo, right? Exactly.
And they'll draw that at the end of the day. So coming back here, we're going to talk about more of these procedures, and we'll talk about procedures for men. Thank goodness. We're here at CaloSpa in the OR. We'll be right back.
On a new season of Family Feud.
Weekdays at 4 p.m. on Wave 3 News. The great deals continue in 2019. I'm Tim Jones back for Toyota of Louisville, and here's how we can save you money on a brand new Camry. You can finance with 0 down and take advantage of $1,000 cash back. ToyotaofLouisville.com.
Wave 3 News is an equal opportunity employer. For a list of current jobs, go to wave3.com or call 502-585-2201.
If your loved one has been injured or is being abused or neglected in a nursing home, there is something you can do. Call the Nursing Home Injury Hotline at Hughes & Coleman.
Tim Jones back for Toyota of Louisville, and we've been talking about so many great deals. Listen to this. Brand new RAV4, you can finance with 0 down and take advantage of $3,000 customer cash back. Dixie Highway or ToyotaofLouisville.com.
Welcome back. Ready, Set, Perks. What are your aesthetic goals? You can accomplish them all here at CaloSpa. We're going to talk about more of these procedures, and men, we have something for you as well. All right, let's jump into body contouring tummy tucks. I would think this would be a good time of year to get that procedure. You know, in the winter, you're covered up a little bit more, and if you have some issues, like you said, that you're concerned about, it's about your confidence. Tell me a little bit about body contouring, Dr. Mays.
Right. I mean, I sort of agree and disagree with your statement. I think any day is a good day for a tummy tuck, but you know, in the winter, definitely when you're wearing a garment over top of the surgical site for 4 to 6 weeks, it definitely helps to conceal it in some of that thicker clothing you might wear. But body contouring is not just tummy tucks. You know, that's part of the mommy makeover is that tummy tuck where you do the breasts and the abdomen together. But it's also liposuction. That's one of the most common procedures, is where you remove fat from the body surgically. We have a lot of new techniques now, power-assisted liposuction, that really changed the game in the way we harvest fat. We also transfer fat. Earlier we mentioned transferring fat to the breast to augment them. We can put fat anywhere in the body, anywhere someone might want that fat. And the most common thing probably in the last 3 years, or the trend, let's just call it a trend, is something called Brazilian butt lift or gluteal augmentation or fat transfer to the buttock, is where you're basically giving mostly women just the shape of that buttock area that they're looking for, a little more rounded, sort of carving out the waistline. And that's been a really popular trend we've seen in the last few years. And the safety of that procedure came under a lot of scrutiny at first. So Dr. Calabrese and myself really looked into the procedure, make sure we're doing everything safely, and possibly here in our accredited surgery center to make sure those procedures were done adequately and safely for all the patients out there who are coming to us. People are traveling all over the world to get these procedures, and they were having some bad complications. So we took it upon ourselves to offer those procedures here safely so people didn't have to travel for some of those procedures. And it's been great to offer that.
Yeah, another place we put fat is in the face. And so the fat, which he mentioned before, fat grafting in the face is another great place. So, you know, we kind of think of fat as bad, like nobody wants their fat, but fat's our friend. And, you know, in the wrong places, fat's bad, but in the right places, like in the buttocks and or sometimes in the breast to enhance them without using implants, and or definitely in the face where we start to lose some of our volume and fullness, fat's our friend and actually is precious to us in a way, because we like to use fat. It's somebody's own tissue that we can use to volumize people, which is best.
I'm going to remember that one. Fat is our friend.
Fat is our friend. Exactly. Fat is our friend.
Moderation.
So, yeah, exactly.
What's nice here at CaloSpa, it's a lot about the options. When do you know if someone, okay, liposuction, tummy tucks, cool sculpting? I'll ask you, Dr. Mays, you know, how do you determine which procedure that maybe a client needs?
Right. I mean, like Dr. Calabrese said earlier, sort of what it is that's bothering the patient. They need to come in and tell us what it is that's bothering them. Every now and then, someone will show up on the schedule and says, oh, I'm here for liposuction, and you go in and do your exam, and you realize they have some extra skin that's hanging down, and that's not liposuction. That's when you're actually removing the skin for something like the tummy tuck. So we're there to guide them through this process. Once they tell us what their goals are, it's our job to get them through that process safely to provide the adequate procedure. But, you know, there's times when people come in who say they want something, you're like, you're not the best candidate for that. Let me guide you down this pathway. And you mentioned cool sculpting. That's one of the non-surgical ways of removing fat. We also have other ways, something called True Sculpt or Thermi-Smooth, that are designed to heat the fat to remove it. And those are non-surgical procedures that we do over in the Medi Spa. But the surgical procedures we do here are liposuction and the mommy makeovers and the tummy tucks and all those things that we mentioned earlier.
Well, in 1997 when I started practice, it was a lot easier because if you wanted to tighten your face, you had a facelift, and that was all you had. But today, there's so much more that we can do, which is good for patients. But number one, you have to have the option, so you have to own the lasers and devices and have them available. Then you have to know who they work in and who they don't work in, who's a great candidate, not a great candidate. And it's a continuum down the line, you know. And so now we could do all therapy to tighten the skin, profound. Same thing here. We could do Cool Sculpt, True Sculpt, M-Sculpt, Thermi-Smooth. A lot of options. A patient can't figure that part out. That's why we have Ready, Set, Goals. That's why the patient comes in for a consultation. We work through what the best. And it may be you don't need Cool Sculpt, you need a tummy tuck, right? But that's the whole idea, is that at least when you come here, you're going to get what we think is best for you, versus if I own a little spa across town and that's all I own, and I just bought Cool Sculpt and I'm trying to pay it off, I bet you're a good candidate for Cool Sculpt, no matter what, right? Yeah. It's what you have, it's what you know, but if you have them all, then we're not really vested in any one particular technology. We want what's best for the patient, and we'll be glad to do the surgery, or we'll be glad to do something less than surgery on patients to get them the results and make them. Not everybody needs a home run to be really happy with their procedure. So a lot of patients would prefer a non-surgical option that significantly improves them, but doesn't make it perfect, but they can avoid being under the knife and all that sort, and that's perfectly fine.
All right, before we go to break here, we've got about a minute left. If you could list, Dr. Mays, some of the procedures available for men, because we don't want to leave out the guys.
Right, of course not. We already mentioned one, hair restoration. So we do a technique called follicular unit extraction. It's where we take hair out from an area that is not going to lose your hair and put it in an area where you've been balding. We do that for men and women, but most commonly men. The other, as we actually mentioned earlier, is gynecomastia. It's where we remove sort of chest tissue from men. They have, they're working out really hard, but they just have this tissue that's been there since maybe they were in their youth time, and maybe it's not gone away, and that's something we can sculpt as surgeons to give them that chest that they've been looking for when they're working out in the gym. They're not quite getting. Those are the two most common things. And then,
facial rejuvenation.
Liposuction. Liposuction is big for guys too, and facial rejuvenation, eyelids, and doing little lower face lifts. The best thing I think for men now is M-Sculpt, which is sort of the muscle tightening of the abdomen non-surgically, where they come in and do a series of treatments over 2 weeks, and it basically gives you that six-pack. It's using sort of electromagnetic energy to contract the muscle. Ooh, it's intense. It's 30-minute treatments, but it's really fun. You add that to CoolSculpt for melting the fat, tighten the muscle. It's something we do. It can give some really incredible results without having surgery too.
And Mira Dry for sweating. So we have the technique here to remove sweating and odor from the armpits. That's very, very popular.
There we go. So many options.
We can get rid of your eye bags, which you mentioned already. I didn't mention them. You mentioned them. And that'll save you on bag fees at the airport, too. Because they go all that, it's really
first class.
We got to run. We'll be back here. CaloSpa OR. Wave 3 listens.
I'm attorney Mike Sullivan. Every day, I get up to go to work to take on the government for you. What worked last week, last month, it may not work tomorrow. Your own case is unique. That's why you need a lawyer who's willing to sit down with you before court and go over the hard elements. Don't let a good case turn bad. This is why you need a law firm that only does disability claims. Let me do the heavy lifting. Call now.
Call 888-587-0228. Call now.
Many times, on my first call with a client after a car crash, they tell me they're not the type of person who sues. If you feel that same way, here are two very important things you need to know. First, many times when you hire our law firm, we can resolve your claim without suing anyone. And second, if you do have to sue someone, you're really suing their insurance company. Their insurance company is responsible for paying the claim and defense. We rarely, if ever, bring claims against people without insurance. Now you know. Morgan & Morgan, forthepeople.com.
It's the Progressive Louisville Boat, RV, and Sports Show. If you'd like to win tickets, it happens next week, but you be caller number 3 at 888-800-9283. Boats, RVs, motorhomes, everything under the sun, under one roof. Again, 888-800-9283. It's all about education. You have some lunch and learns coming up here, right, Dr. Mays?
Yes, we do. We have them all throughout the year, but our next one's going to be on February 21st, and it's all about women's sexual health. So we're going to have some of our mid-level providers there, as myself, just to talk about all things women. Vaginal rejuvenation from surgical to non-surgical, just women's health. But the main concept is going to be vaginal rejuvenation and labiaplasty.
All right, once again, like CaloSpa on Instagram and Facebook. We'll see you next time. It's beautiful here at CaloSpa. See you tomorrow on Wave 3 Listens.
Bye-bye.